Okay, good afternoon. My name is Dr. Rubio. Today I will share with you about skin cancer. Skin cancer, we have a different type of skin cancer. We have we call one of the very aggressive type of cancer is melanoma. We have another that we call epidermoid. We have another is a basal, okay? And we have another that we call lymphoma, or we call mycosis fungoide. These tumors, the melanoma can spread very fast. The vasocellular, is not very, they don't spread very fast, but, it's aggressive. And the squamous cell. Mycosis fungoide, is a type of lymphoma, it's in all the skin. These tumors, speaking about, melanoma or mycosis fungoide, the causes of this cancer, we know, is a polygenetic, As a many facts, sometimes we don't put attention, to the initiators or promoters. Like always, we are talking about the diet, the chemicals, the environment. We don't put attention to smoking, drink for years, 50 years, 40 years. We are talking, nobody put attention. And we see, the incidence of cancer more than less. Sometimes we say, okay, people smoke less and they have cancer. Yes, but what's happened for years, they've been passing the information of the genes to the next generations. So, we need to be aware, some member of the family has a cancer, they can pass the gene for the next generations. So, this is what's happening. Sometimes I have patients say, Dr. Rubio, I do a fasting, I have a diet, I'm vegetarian, I don't smoke, drink, and I have cancer. Why? Because of genes. So this is why the role play of the gene therapy is very effective here with immunotherapy. Sometimes, for example, the melanomas, it's a mole, and mainly is more frequently in women than men. And when you see a mole in the bottom of your foot, in the hand, in your back, in the chin, always we gotta look for changes. If we see this small change of the color, shape, form, size, hey, something is wrong. Immediately go to the doctor, okay? Because this mold, they can spread very fast. These tumors grow more than 100,000 cells per day. And they can spread to the liver, bones, lungs, brain, fast. Okay? If you have a suspicious whether something is wrong, you gotta go with the doctor. Doctor gotta do a biopsy. But if you decide to do the biopsy, you gotta work immediately. Don't wait 4-6 weeks to say, okay, Mrs. Lopez, you have a melanoma. So, because the cancer can spread very fast. My recommendation is, if you will do a biopsy, you need to have the pathology in place. They cut it, check it, make the stains, boom. It's melanoma, it's not. Because if you have melanoma, you gotta start working with the treatment for cancer. Okay? It's a combination. So patients do surgical procedures, chemotherapy, and radiation. But now, this combination will do the immunotherapy and the gene therapy. These new therapies that we call immunotherapy, they will give more chances for the patients to stop the cancer. Because it's a combination. They will do chemo, radiation, surgical procedure, and the immunotherapy. This patient will have 99% better chance than the normal or traditional therapies. Like we say, it's a fourth type of therapy that came in cancer that we call immunotherapy. And the fifth treatment of cancer is gene therapy. So we don't have only 3, we have now 4 and 5. Speaking about the immunotherapy in these cancers, like a melanoma, we do, we make your immune system aware that something is wrong to stop it. This technique we call, it's a name, it's a a name that we call RNA transfers of the lymphocytes. So like we do, we give the information from one lymphocyte to another lymphocyte to attack the cancer. And the procedure, like we say, is, for example, a patient does a biopsy, came positive, so we get the cells and we culture the cells in a petri dish, in a box, in the laboratory. These melanoma cells, like we do, we make a receptor because everything we work with receptors. And after that, from the same patient, we draw blood and we extract the natural killer cells. They are the T cells. We added the T cells, will see the receptor, they will clinch, attack, destroy, and they will develop a memory. And this memory in the T cells is for all their life. So in 14 days or 14 days, we withdraw the T cells and we start applying the vaccines to the patients. The gene therapy are, in the DNA, we block the genes that they will perform the cancer. And when we use these blockers, we will have more chances, because the cell will stop to grow. So it's a very nice combination for this patient. Thank you.